Welcome to the Plastic Surgery Channel Uncut. I'm joined here by my good colleagues Dr. Maman and Dr. Reed. We want to talk about fat grafting now because fat grafting is all the rage. We read about it all over the place when you think about big butts and Brazilian butt lifts and breast augmentation using fat. We know that fat's a very popular tool. Dan, you want to tell me a little bit about places where you've used fat in your own practice?
We've seen a massive uptick in patients coming in requesting fat grafting. And certainly we've seen in the last few years that we've been using it for different areas of the body.
We do a lot of fat grafting to the buttock. We do a lot of fat grafting to the face. Buttock augmentation, I think it's potential that our society, plastic surgeons in general, may be getting a little out of control with that. The giant buttock augmentation that some people really want. And I feel like we're going to see with time that may be more problematic. That's not a direct result of the fat grafting, it's doing too much of a good thing.
Do you feel like the fat lasts? One of the criticisms of fat is that there's such a variable survival rate of the fat, so do you have predictable results?
I think it's variable. I think it depends on the harvest site. It depends on the quality of fat and the age of the patient, the health of the patient. It also heavily depends on the recipient bed. How well vascularized it is, whether it's the buttocks or the face, is totally different.
Dustin, predictable results?
I think our results are predictable. I agree that there's probably 50 to 60% take of the grafts, and you plan accordingly, and with rare exception, you can get the result that you want predictably.
And how do you manage those expectations with patients knowing that there is some variable survival?
I just explained to them exactly that not all of the fat is going to live, that particularly in a buttock augmentation, that it's going to be bigger in the beginning, that it's going to end up. And so again, just setting the expectation, and I think most patients accept that as long as they know ahead of time.
We're seeing a burgeoning increase in the amount of fat injections that are happening throughout the country, and the FDA is currently looking at those practices, and there will be more news to come.